We're live. Let's see if I can get this thing to playing. I actually try to do this first. It's not connecting.
This is like a whole different world for me.
Yes, it is. It is. And that's what we're trying to make sure that all is well. All is well. Good morning, people. Hey, Carlos. How you doing? Trying to get stuff to working around here. I should have waited just to make sure that I connected. Right? It's not connected. Can you hear me? Go to WPMM Talk and see if you can hear me. I had to start everything over. I wish I could stop it and hit resume. All right. It is your girl, Kimberly Therese, and we're trying to make things happen. Around here, they're not happening.
It's Monday. You know, that's how it is.
It's Monday. Monday. But it's okay. Hello. Why is it not connecting? Of all days. Do y'all hear it? Do y'all hear it? Do y'all hear it? Well, for some reason my music is not playing and it's all good. We're going to skip that part and get started. It's your girl, Kimberly Therese, with On a Personal Note. And today we have Miss Kelly here with us. Pronounce that last name?
It's Kniss. Silent
Kniss.
K, yeah.
Silent K.
Yep.
Oh, it's funny because when you first left a voicemail with me, it sounded like Nest on the voicemail.
Yeah.
And so I put you in as Kelly Ness.
Well, part of that is me and how I pronounce things.
Okay.
And then also because, that silent K gets everybody. So I get Chris, I get Kiss, I get all this stuff.
Oh, wow.
And I'm like, no, it's like me, silent K. So
Silent
K.
We got it.
Hey, I've been called worse. Kelly works.
Hey, and I'm telling you, first time I said her name when we was meeting, I called her Nancy. I don't know where I get Nancy from, but it is what it is.
That's right.
You know. So listen, we're going to go ahead and get started since my music is not playing today and it don't want to connect. It's all right. It's all good. We still got show. Still got to go on.
Mm-hmm.
So today we wanted to bring something different to you and let y'all know what is needed for such a time as this concerning medical. And before we get started, just remember we are WPMM Radio. I want to send a shout out to the family. Thank y'all for joining us, those that are here and those that will basically continue to connect. Remember, we have the apps, Google Play, Apple Store. Download the apps. And I'll mention this now, and I'm going to mention it at the end of the show. We're not going to continue to go live. We want y'all to migrate. Please start migrating to the apps because we're trying to do nationwide, international wide. We're trying to get all those things going on here at WPMM Radio. You know, we also are affiliate with Cheryl Underwood Show, who airs Monday through Friday from 11 to 3. See, I have my notes. From 11 to 3. Download the app so you can hear her too, because that's the only thing about it with us being affiliates. We have to learn to migrate over, and we need y'all support to download the app, or just go and Google it. Google WPMMtalk.com, WPMMradio.com, because we're trying to go different levels. We're not trying to stay local. We're trying to be international. And so download that. Y'all know we have business advertising. We ask for sponsorships. We also conduct, you can contact us for that, and donations. We're taking it all to have our station to grow. So, contact us, WPMMonline.com at gmail.com. Sorry. And, just know that we're here for you. We're here to, kind of take it to the next level. But we also are a U-Haul company. Y'all do not have to wait for us. The doors do not have to be open. You can always book online and go from there to really do what you need to do, and rent your equipment and supplies. The number for that is 850-378-0347. But look, we're going to go and get started. I know I'm probably missing some things, but if I think about it, then I'll come back to it. Like I said, I'm going international. We're going international. I'm going to the internet. I'm going to stop going live. I feel like there's other things that we can be doing outside of just the Facebook Live, social media live. So we want y'all to understand and know that we're doing this for the greater good, to go higher, higher, and higher. But let me read the disclosures and then the disclaimer, and then we can get started. The views and opinions expressed by individual radio hosts and guests are of their own and does not necessarily reflect the official policy or position of WPMM Radio. WPMM Radio does not intend to malign any religion, ethnic group, club, organization, company, individual, anyone, or anything. And so, listen, it's time to get started. So we're going to talk about medical needs. Medical needs, and we have here our guest today, Kelly Kniss.
You got it.
And I want her to just explain to everybody what she does. You can pull it to you.
Yeah. Well, first of all, I want to say thank you so much for having me. I'm
Yes,
so excited.
ma'am.
I've always wanted a microphone in front of me. Oh, I got it. Watch out.
Yay.
Yay.
She's like your girl.
Yeah. So anyway, I am a licensed Medicare broker. I am licensed here in Florida and Alabama, also in Michigan. But I have my own business. It's called Complete Care Insurance Services, but Kelly Kniss is fine as well because it's just me. It's just me. But I'm a registered nurse by trade, and through different things that I've seen, and then me just kind of wanting to have more control over my own schedule, it kind of led me down this health insurance road, and specifically Medicare, because that is the age group of patients that I dealt with. So for me, it was a no-brainer, and it's I love the idea of it, of helping people with this, because it's something that they have to have anyway.
Right.
And with being a broker, you're licensed with all, for me, all the different companies in the area, and so then I'm able to really work for my clients and find what's the best for them.
Right.
And I think that's so super important. And it's just a great segue from my nursing background. It's just another way to help people with their health care. So, and that's my goal, is just to be, a resource for people and be able to answer any questions and help them any way that I can.
Okay. So how do you step into, do you go out, or do you just by word of mouth or referred? How does that work?
It's a little bit of everything. So I am new to this area. I've been here for about 3 years. My husband's active duty stationed here, but we won't move again, thankfully. We finally get to set up some roots. So I've been getting out in the community. I've been volunteering. I'm part of the Santa Rosa Chamber of Commerce now. So I'm just trying to get out, get my name out. So whether people refer to me or I just happen to meet them. I also had a spot at T&W Flea Market. I'll be starting back there again in August. They're on Saturdays. So just handing out free information. If people want my help, then they know where to find me.
Exactly.
So that's how it goes. Yeah.
And for y'all that don't know, Kelly, I met Kelly through Victor Smith, who has been a very, very good resource for this community. I don't know if y'all know him. Last week, and I'll just briefly tell y'all this before we go to the next one, next part. Victor is an older man who just out here trying to connect people and make it happen for our community. And with that, he actually opened the door for me, not only to have Kelly here and 3 other women here, but he also opened the door for me to do some work outside of Pensacola. We have actually went to what you call a home for disabled people. And when I say home, I don't mean house. I mean a whole small society for disabled people. And it has opened up so many, it opened me up so much to be there. It was a 3-day trip, and I got to see how they work, how the government work with people that are low, don't understand what life is about. Somebody, and I don't want to say it, are mentally disabled, but they are mentally disabled, and it was from high functioning to low functioning people, and they have created a concentration camp, if you will, kind of sort of like
community.
that. A community, thank you. A community for these people. And it opened up my heart, because when I say they had everything for these people, I'm going to be posting pictures. They had a ranch. They have jobs like within the community for these people. And I hate to say these people, because I feel like it's just
that community that you're talking about.
Right,
it is for those people. And,
and it's like for people that have birth, mentally retarded, is that disabled, mentally disabled people, and they have literally made them self-sufficient. Like, it's awesome. It was a different take on life, and I'm like, you know what, that's wonderful, because sometimes we don't know how to take care of them.
Right.
And
it all comes back to quality of life.
Right.
I mean, and so now, and everybody deserves a good quality of life, whatever that might be for them.
Exactly.
And so I think that's wonderful. And back to Victor Smith, I mean, I think he's just a wonderful
man.
I've been so blessed to meet him.
Okay.
He's just an awesome person. He's very kind and giving and genuine and funny. I think that's why he likes having me around, because I laugh at all his jokes.
He is funny.
But he's funny.
I'd be like, okay, I need you to stop.
Yeah, but he's amazing.
And that's what we look at too. We look at the fact that there are people in the world that really genuinely want to help, genuinely want to be a part of making life better, quality of life better. And to experience that in itself was different for me, because they had classes, they had jobs, like they have landscapers, certain sect that are able to landscape, certain sect that work in a cafeteria. They had a mini mall
right
for them.
Well, that's amazing. And see, it just goes to show that we all have our gifts, and and so there's something for everybody. So I think that's amazing that there's a whole community there.
And that's right. And our duty was to get there and tell them and reassure them that it's people outside of their living quarters that really want to come in and teach them what the government said, what law says. If they're not being treated right, if they're being mishandled, they have a right to speak up. Because I'm learning, even with Miss Rosa, that's her name. Rose is the lady that I actually got to share hotels with, and she was like the teacher, and we did little skits for them on the right way to do job interviews, the wrong way to do. I got to reenact of being just ghetto at a job interview, but then I had to come back and be professional. Yes.
Well, I think that's amazing, because people don't know what they don't know.
Exactly.
And a lot of times we take things for granted. Like, I'm a nurse, so I understand how the body works and this and that. But that doesn't mean that you do.
That's
so we have to have a way of breaking it down, like I say, kindergarten style, to make it simple.
Right.
And I need people to break it down kindergarten style for me, certain things.
Oh, so, God, yes. I'm the same way. So we know that Victor is connecting people, and that's how me and Kelly got connected, because she began to talk about what she does, and we're gonna head on into that, because we got 45 minutes left, and we want to cover all grounds. So with you coming forth with Victor, and me and you meeting, and you're showing me, hey, I can help you with your mom, because that's what she's doing. She's helping me with my mom, because my mom is getting older and she needs to be looked after in so many ways. And so Kelly have stepped in. I called Kelly in basically to help me with mom, but also to get the word out there, because it's things that we don't know. And I'll just let her take it from here to kind of give y'all a take on what's going on. Yeah,
so what I do is I educate people on Medicare, their options, because you have different options for coverage, and it's just a subject that's very confusing to everybody. It was confusing to me.
Right.
And it was actually, like I said, I was looking for a way to be more flexible and kind of be my own boss, but still be able to help people and still be in the healthcare realm. And I had one particular patient who, you know, we just worked with over and over with, and she just kept going to the emergency room, couldn't get to her doctors because she couldn't afford it, her insurance didn't cover her and medication that she needed. And I was like, man, this is like, I just didn't realize how important insurance was.
Yeah, really
my
important.
Husband's active duty, so we have TRICARE, and I just go where they tell me, and I'm thankful to be able to go, and that's it.
That's right.
You know, so I had to learn, and so that's what led me down this road. And so but there's you know, the different parts of Medicare. There's Part A, that's the hospital coverage. The Part B, that's your doctors and your outpatient. And then of course then you have the extra parts of it where it kind of helps to protect you from the different costs that maybe original Medicare doesn't pay. So then you have options of, you know, whether you want to go with the supplement plan or should you go with the Medicare Advantage plan that you see on the TV all the time. So that's what I do, is I just educate people on those different parts and plans, and then I do an assessment for each of them to figure out which one is going to be best for them based on their economics, what can they afford, because if you can't afford it, it's not going to be any good for you. What their doctors are, who their doctors are, what their medications are. So each person is very individualistic when it comes to this. What's good for one person isn't necessarily going to be good for you. That's why it's very important to talk with somebody who can help you. The wonderful thing about it too is that my services come free of charge to my clients. If I get paid, it's by the carriers that I represent.
Gotcha.
So, and I really love that as well, because it allows me to work for my clients, and I think that's amazing.
It is amazing. So let's cover Part A.
Okay. So Part A is, like I said, that's the hospital coverage. So that is when you, well, first of all, let's start this. People for Medicare, you've got to be either 65 and older. You have to have been on disability for at least 24 months. Or there's some people who, you know, if they have end-stage renal disease, ALS, they can get, you know, Medicare right away. You also have to be an American citizen or at least worked or lived here for 5 years.
So basically, if I became disabled, I could get it
after 24 months of being on disability.
Yeah.
So there are, you know, certain guidelines or hoops or what have you, if you, whatever you want to call it, you know, that you do have to help you qualify. But then we have original Medicare. So we have the Part A, and that is the hospital. So that covers you in the hospital. That covers your room and board, basically. And so then you also have your Part B. And then what that does is that covers the outpatient services and the doctor services. So say when you're in the hospital, you have doctors that are seeing you. Your Part B covers that.
Gotcha.
Now, most people, because if they've worked most of their life or they have a spouse that has worked at least 10 years, they have paid for their Part A out of their taxes. That's the FICA taxes, the taxes that come out of your paycheck. So you've already paid for those. Part B comes with a monthly premium, and for most people it's $148.50 right now for 2021. I'm sure it'll change again. And it is based on your income. So
I was going to say, that's a lot for...
inflation is, I know. I know. But it, like I said, though,
it's based on your income.
It is based on your income, so if you have a much higher income, it can be more. But if you have, you know, we do have state Medicaid, you have, you know, the state-funded programs. So I also do this for people. I look at their income, and if, you know, I think that they will qualify, I will help them apply for some sort of state assistance, and if they do qualify, then the state will help to pay for those Part B premiums. And then there is a deductible too. So there's kind of a lot of numbers that go along with it. But the biggest drawback of original Medicare is that there's no maximum out-of-pocket cost. Meaning that if you go into the hospital, you know, 4 different times out of the year, then you know you're going to be paying every time. So that's where people will get that extra coverage of either a Medicare supplement or a Medicare Advantage plan. So then you have like a cap of what things are going to cost you. Now those different plans kind of work differently, and you know it's kind of a lot to go into. Right now there's a lot to learn, like I said. But it's important to know what your different coverage options are. Then of course we have the Part D. That is a prescription drug coverage.
There's a Part D?
There's a Part B. There's a lot of different parts, and that's why I say it can get confusing with parts and plans.
Right.
But the biggest ones you want to remember is A, B, and D.
Okay.
Those are, the hospital, the doctors, and then your prescriptions.
Okay.
And then you just want to see what extra plan should you get to kind of help you along with those costs.
Gotcha.
Supplement plans normally cost you more per month, but they're nice because you pay your deductible and that's about it. The Medicare Advantage plans, those usually have a very low to no monthly premium depending on the plan, but then you have co-pays for services along the way.
Right.
Now they all will give you the preventative services, that's included with original Medicare. So your screenings and such, like mammograms and colorectal and all that kind of screenings. Those preventative things are included. But yeah, so the biggest takeaway from all of that is, you want to talk to somebody who can kind of help educate you and break it down for you.
Right.
Because like I said, everybody's different. Everyone's different.
Okay. So Part A is more or less Social Security and Medicare.
So what?
Medicare.
Part A and B is original Medicare.
But that's more hospital.
That's all hospital.
Hospital.
That is you sitting in that building.
Right. Mm-hmm. B is doctor visits and
services, the medications that you get. So if you get an IV, IV fluids, that's going to be your Part B. If you need a cane,
even if you're in the hospital,
yes.
That covers the accessories.
Exactly.
Basically. Yes.
Right.
Okay. And doctor visits. Okay. Outside of the hospital.
Outside of the hospital or inside, yeah. It's the doctor services.
Okay. Yeah. And Part D is for prescriptions.
Correct.
And for as prescriptions, is there a cap on that?
There's usually a deductible. It kind of just depends on what kind of plan you go with. So there's usually a monthly premium that goes along with that, or you can sometimes get an Advantage plan that has that in there. Okay. Like I said, that's why there's so many different options. It's such a good
and that's what I'm trying to understand it too. I'm not just doing this for y'all. I'm doing this for me too, because this is something that I'm gonna have to help mom and my stepdad make a decision on her. And so D is basically where we're at now, in our whole journey of getting her insurance line upon line, precept upon precept with that, because we actually see her some of her prescription bills coming to the house now, and we're like, okay, we need to. So that's where we're at.
We need to see what honestly, like what plan she's got. But we can look at that and see. And so and then we do have. So every year, Medicare has their annual enrollment period coming up. So it's not like you're, if you get yourself in a plan and it's not the best fit for you, you do have an out. Right. So that runs from October 15th to December 7th, where you can make a change to your plan. So if you're on a Medicare Advantage, but you want to go back to original Medicare and just have its own Part D coverage and a supplement plan, you can do that, and it would be effective for the next year. So you do have different options of things that you could do, and I highly recommend having someone help you review that, because especially the Medicare Advantage plans and the prescription drug plans, they change every year. Gotcha. So you can find that you might end up getting some extra benefits or saving some money. And if you don't, if whoever you deal with, hopefully me, finds that where you're at is the best thing for you still, then you just stay there, and then you look at it again the next year. So
and that's the thing that I look at too, is just being able to find what works for us. And one of the things that my stepdad said to me was she had Aetna, and then it switched to WellCare.
Could be, yep.
WellCare now is Humana.
Okay, so she's done some switching.
Yeah, she's done some switching. And I was fussing about Humana because it's like they changed everything from WellCare to Humana, and we want to say that they said Mama did it, but Mama, it is what it is.
Did she get a call?
Yeah, and she, we have to school the older people on what these phone calls. A lot of these phone calls are not worth the time or the money or the effort to get things back straight. And that's where our problem came in at.
Well, and I think also is that, anyone who is talking to anyone. If say I were to talk to your mom, I would
Right.
ask, do you have somebody that helps you with your healthcare decisions?
Right.
Because we all, I think we all need people to help support us, and I think especially with that generation, we have to kind of watch out for our loved ones,
Right.
and don't want them to get taken advantage or to accidentally make a change like that they didn't
Yes.
really want to do.
Exactly.
So it's really good. That was something we talked about, was
Right.
advocating for
Right.
our loved ones or family friends or what have you, and just
Right.
being there as the eyes and ears and the support and to
Exactly.
help make those good decisions for
Right,
them.
because we are getting wiser, more educated, but even in that, our family is at a point where they don't understand why, they don't understand the whole upset of why things are getting changed and different stuff like that. The biggest thing for us is Humana, we're finally getting it smoothed out with Humana, but when I say it took us from the end of March to like 2 weeks ago to get everything back to rolling with her, it was a big upset because it was frustrating, it was stressful, but we had to pull all cards out.
Right, and this is kind of a little bit of both hats, Medicare and nursing. But when you switch those plans, depending on what type, because those are called managed care. They're network plans. HMOs have a much tighter network, and you
Right.
have to go through your primary care doctor to get referrals
everything
to those specialists. So if you're in one of those type of plans and you swap to another one, you got to start over with that referral process
And I'm
again.
telling you, it was, whew.
Yeah.
We was like, and the thing about it, I was getting all the phone calls because my stepdad and her agreed, hey, you handle that part, and we'll just tell us what we need to do, and that's been good trying to migrate over. But what my stepdad shared with me was he shared with me how even though where it might be more expensive for her medicine, it still pans out the same.
Yeah. I mean, either it pans out because it's a less of a headache when it comes to those providers, or however that is. But yeah, and sometimes it is. It's the lesser of the two. What do you value?
Exactly.
And that's why I say everybody's different. You know. So and like I said, a lot of these plans too, they have some extra benefits, and maybe maybe your medications are a little bit more expensive on this plan, but they got some extra benefits that really help you a lot. Then you decide that that's the best for you.
Right.
So yeah, it's a much bigger picture. It's not just a simple fix, because they're all so very different, and like I said, they change every year. So it's just really good to talk to somebody who understands them and is has to do training to understand.
Right.
Yeah.
Now, do you have a setup where you can do like host seminars and people come in?
Well, that's what I'm hoping to do, and that is one of my goals. And you sat in on that one that I did with Mr. Victor and the whole group, and I really love that. I mean, as a nurse especially, my background is educating people on whatever it may be, so I love to do that. So yeah, I'm really hoping to group up with 55 and up communities, maybe even some assisted living facilities if that's appropriate, what have you, just to do even church groups or something like that. Periodic Medicare 101, just to come give free information.
Exactly.
I mean, and then hey, if you decide that you like me and you want me to help you, give me a call. But if not, at least you have the information.
Right. And that's what I look at too, because I'm 46. And even though she said 55 or over, 65 or over, but you was wanting to teach.
Oh, the 55, because they're going to be turning 65. Or if you're on disability. Right.
Yeah. And okay, let's talk about the disability part, because so many people, and you being a nurse and being also in this field, so many people have this tough time getting into this disability.
Well, that's true. Yeah.
What are the things that we can do better?
Well, this is not my exact forte, but I did help my mother-in-law. She had to apply a few times, and thankfully third time was a charm when I was there to help her with this process.
Right.
A lot of people do get denied, and they'll either just keep trying, or they'll get themselves a lawyer that will help them too. So for me, what I tell people is, like, if you truly have a disability and it is impacting you and you cannot go to work, just keep trying.
Keep trying.
Just keep trying.
And I've heard that by the third time, they'll kind of give you what you need, but they want to know that you're not just trying to get some money.
Yeah, exactly. Because there are people that we all know there are people that work the system.
Exactly.
And so they have to be able to tell the difference. And I'm certain that probably, and I don't know, but I'm just guessing, it's a lot of work to go through that process.
Yes,
they're
Lord.
like, they're hoping maybe it's a weeding out process.
Right.
So by the time someone has applied the third time and went through the whole deal,
exactly.
But like I said, that's not really exactly my forte, but I did help my mother-in-law with that. And I just do tell people, just don't give up.
Don't give up.
Or go talk to a lawyer and see, but.
That's right. And that's the thing about it is we as a people, we are quick to give up when stuff don't go our way.
Definitely.
I'm guilty of it.
I am too. I am too. Get tired, like, oh, well, maybe this isn't the right road for me.
Right, and just let it go. And the biggest thing is we have to fight for our rights to be, heard and to get what we need, because government is set up for such as things like this. Mm-hmm. They have to comply, even though they don't readily comply. But we have to not give up and say, you know what, I'm done with it. Because we get tired. We get tired of fighting, and we'll be like, we're just going to go to the hospital and they can bill us later, and we never pay the bills.
Right.
And we end up with bad credit and everything, but this is part of it. And now, they say, this is what they say, the credit fixers. Yeah.
Credit
fixers. Yes. Okay, I'm going to say it right, the credit repairers. And I have been guilty of it as well, knowing that medical really don't count a lot in the bureau, but you still don't want it on your record.
Well, and still, I mean, and I don't know how it is anymore, because like I said, now my husband's active duty and we're TRICARE, but I know before we had no insurance. Right. And so, I was much more safe person, but he was a little bit more reckless, so he'd end up in the emergency room from doing something stupid, whatever. But as long as you're paying a bill, so even if it's $5, whatever, as long as you're making an attempt, then that is better than nothing.
It is.
Something's better than nothing. But there is a bit of a flawed system, and I know that they're trying to work on that, and but that whole government thing is way above my head, and everything moves very slowly, and I just don't have the patience. So I just kind of try to go with the flow on that and not concentrate on it too much. Right. But persistence is the key in anything. In anything,
because they're faster to give you Medicaid than they are Medicare. And that's what I look at is but you need both, especially at age of 65.
Right.
At the
I mean, if you need that extra financial help, I mean, it makes an impact.
Exactly. So what is your process once everybody comes in, like say for instance, hey Kelly, I'm Kim, I want to see you about me getting help medically. What is the process for that?
Well, then I start asking some questions. So I ask them, what kind of coverage do they already have? If they don't, then we kind of go down another realm of questions. Right. But so say somebody comes to me and they're already on Medicare and they have a plan, but there's a reason they're coming to talk to me. So I say, so what is it that you like about what you have, and what is it that you don't like about it? Okay. And so that kind of helps me to narrow down, what exactly we're looking for. Like I said, though, I have to know those doctors. I have to know the medications, because not every plan will either accept your doctors or will cover your specific medications. So that's a huge part of it. Also your pharmacy. So it's just it's what we call a needs assessment. Right. And my nursing career has kind of really helped me along with that, because I'm used to doing assessments. I was assessing people all day long. Right. But yeah, the biggest one is your doctors, your meds, what pharmacy do you use? Do you travel often? Are you on a fixed income? Right. The other one we talked about, do you have anyone that helps you with your health care decisions? Anyone that I should be talking to? Are you getting any state assistance? Because those people, they can get special plans. So, it's all about asking questions and just trying to dig out with them, why did you come see me? Right.
You say you're from Michigan, right?
I'm originally from Michigan.
Okay. Did you do any work nursing down there?
No. My husband joined the military when we were in our mid-20s. Mm-hmm. And so he's been in for 18 years. So no, since then we've been moving. And I was actually a waitress bartender. Yeah. And I had a great time with it. But at one point
I can see you doing that. I can see you doing that.
I was even the clown on kids night. I was making balloon animals and painting faces and stuff. But yeah, then eventually I was like, my husband said I had to get a grown-up job. So
that's a very adult job.
Yeah. So I went to Hawaii Pacific University, and when we were stationed in Hawaii, and I got my bachelor's in nursing. Okay. And so then we've moved all over since then. Not all over, but anyway, and then so we were here for just over a year, and that's when I was like, I really want to get into something that gives me a little bit more of flexibility with my schedule. Right. Still be able to help people. I don't have to wait for somebody else to do their job. I was gonna, like I told you before, I was gonna go get my doctorate in nursing, but I didn't. Then I started thinking, do I want the student loans? No, I don't really want that.
Right. No,
so it's kind of led me down this road. But I've got I worked for the VA in St. Louis. I worked for the VA quickly here at the clinic, and so I've done hospice and palliative care. So I've done a lot of different things, but it all comes back to helping people.
Right, and that's why I asked, because I was going to ask, how different are the states as it pertains to, but you only been here doing the brokers.
Yeah, and Florida. I am licensed in Alabama too, but most my business is I'm venturing out into Alabama, and I'm trying, but and I will get there, but really it's been mostly here, and because I really think you got to get a good footing under you no matter what you're doing.
No matter what.
You start trying to do everything, and then you're not very efficient. You know what I mean?
That's me.
Well, I have a tendency to do that too, so sometimes I gotta pull in that rein.
Right, and get it done. The biggest thing is we have to understand that our health is important, and what we eat, what we drink, and what we intake is a huge reason why we suffer.
Well, hey, let's be honest. Either you can eat your medicine through your foods and all that, or you can take some chemical medicine one day down the road. I mean, one way or another. But yeah, so that's what they say though. Food is medicine, and I'm guilty of it. Like, I love my fast food. I like my Diet Coke. But it is true though. I mean, it really comes back to what we're putting in our body.
Yeah, it does, and that's one thing that I'm striving for. I'm doing a lot of more natural things than I am prescriptions. If the natural don't work, then I'd be like, okay, whatever.
Yeah.
Let's go with it.
Yeah, sometimes, sometimes we do need that little extra, like with an antibiotic. If you've got an infection, you need an antibiotic, you need to take that, Right. But there are some things, but there are some things where, you can do more natural things. And a lot of this stuff it's preventative. If we can just prevent problems. Right. But then there's people that, they're past that point. So now we got to figure out how to fit, or at least, if not fix the problem, Band-Aid it. So,
Exactly.
But
so we got 20 minutes till. I want to, and it's going by fast. And so I want to talk about what is your goal overall in this business?
So my goal overall is to be a trusted resource in the community, no matter what it is. I do volunteer. I love to volunteer. I most recently have been volunteering down at the homeless encampment we talked about. And I just once a week, just being down there, I was actually brought down there to help with Medicare. Kind of found out about my nursing, and so now it turned more into that. But that's okay too. It doesn't matter. I'm just trying to get people to know me. I think that if they get to know me, then they can see that they can trust me, and I'm a genuine person. So I am looking for anyone who wants help, education on Medicare, any private person. I would love to, like I said earlier, couple with 55 and up communities, even churches, anywhere where I can, meet people and people can meet me, and I can be there to be of assistance. I just really want to be, like I said, a trusted resource, and I want to be able to pay my bills
Right.
and still be able to volunteer and do all
Exactly.
that. So I'm really getting out of my comfort zone and trying to meet people. Like I said, I've never been on, I can't even believe I feel like a celebrity right now being behind this microphone. But just getting out and networking and meeting people. And I think that, if they get to know me, then they'll see, hey, we should call Kelly. Kelly will help us out.
Right. And that's true. It's a push, but also it's rewarding to do it because you see how many people you can help. Have you helped the homeless as well with this?
I have only helped. Well, I've only helped one person get their coverage. However, I have helped other people. Like I had a gentleman who had already had coverage, but he didn't know who his primary care provider was.
Gotcha.
I don't know who signed this guy up and didn't help him.
Right.
So I called the company and found out who the primary care was, gave the information to the gentleman. So now he can go to the doctor. Because he needed to go to the doctor. He had heart issues and all that. So I do help out any way that I can. And like I said, a lot of the stuff I end up doing is like pro bono, if you will. But I feel like if you do the right thing for people one way or another, you're going to get rewarded.
Exactly.
And it may not be today and it may not be tomorrow, but it will be one day down the road.
Right.
So, I just want to be proud of myself when I lay my head down at night in my bed and not, be regretful of anything that I've done.
That you haven't did everything that you could have did.
Right.
To either prevent or help.
Yeah.
And that's what we look at. I don't know how the homeless go about doing it, but it'd be good too, because I've noticed a lot of them are out and about, and you wonder how are they taking care of themselves.
Well, and it's kind of hard to track some down because you'll have some people that you see all the time,
right?
But then you have some where you meet one week and then the next week they're gone and you don't know where they went.
Exactly.
But I am of the thought process too, and this probably goes back to my nursing and having to have boundaries, but you've got to be willing to help yourself as well. So I'll be there to help in any way that I can, and this is anybody, whether it's my children or whoever, it doesn't matter. I will be there to support and help you in any way, but you gotta help yourself too. You gotta seek it out. You gotta
Yeah, and that's what we run into. Cedric, we're talking about we're actually talking about Medicaid, Medicare, Part A, B, and D, and we're talking about how old you have to be, what all is required, and different stuff like that. So with our age group, we're not ready for it yet, but we're getting the information out here because you might have, like your mom, your mom might need more help and coverage, or your lady friend, or your guy friend, or your husband. We're just actually putting out the news of what we're doing, what Kelly do. She's an insurance broker, and she's just giving all the information needed, because like with me, I help my mom, so I need more information as it pertains to insurance. And with that, she's explaining the breakdown of it,
Yeah, and a lot of people, they just don't, and I am guilty of this too. I am leery of everybody. I don't really trust anybody, especially when it comes to my finances or what have you. Right. So it's hard to know who to ask. So a lot of times we just don't ask.
Right.
And so I think it's an important thing. But I do want to just say this real quick, because I am it's health insurance, although I do focus on Medicare, but it is still open enrollment for all of you for the Obamacare, for the ACA,
right,
until August 15th. So for any of you that don't have insurance and need it, you can get online and you can look and see if you get any extra subsidies, because there's a lot of extra subsidies out there for people right now, but it is only until August 15th. So that's just something for people to know.
Right. Well, I actually applied for it and I got it.
Okay, good.
So with that, what's the extra
subsidy?
Yes, subsidies.
Mm-hmm. Yeah, they're throwing out some extra. So basically, extra money. They're giving you extra discounts. And it's because of COVID. I mean,
it's already included though once you sign up.
Did you go? Where did you go? Did you go to healthcare.gov? Wherever you went, did you put in your income and all that? Yeah. So then it came back and said, oh, you get so and such money credited per month or whatever. So it's already embedded in there once you just put in your personal information.
Okay. Okay.
So I just want everybody to know that it's I'm happy to help with that, but that's not really my thing. Is more Medicare, but people can, if anyone has any questions, they can feel free to call me.
Right. So basically, they can go to healthcare.com if they need insurance.
Outthere.gov or I have my own personal link as well. But if anyone just wants to get a hold of me, then they can do it that way as well. But either way, it's just the most important thing is to know that until August 15th, if you don't have health insurance, get on there and just see.
Go get it.
Just see if because you might be able to get it for dang near free.
Especially since it's COVID, everything is it's kind of open for us. You have it. It's available. Mm-hmm. Go get it. So
that goes back to helping yourself. You
right.
know what I mean? Because nobody's going to give it to you, especially when it comes to anything like that. You got to seek it out yourself.
And that's what the thing that I did from my mom's last doctor appointment, when she wasn't told. This is another thing with the Humana. She was not told that she had to pay so much money up front and to get a mammogram. You heard what I said, a mammogram.
So I'm assuming, and not to go into any of her healthcare or anything, but it's probably a diagnostic, I would assume, meaning that they had seen something previously, whether it was anything or not. Yes. But now, once they have, it's always going to be what they call a diagnostic.
And so that's what we pay for, the fact that it's a diagnostic.
Because, exactly.
Wow.
Yeah, see? So same with me. Nothing ever came about of anything, but now here going forward, mine will always be diagnostic because they had found something at one point.
Got you. So how can you get around that? Because if you don't have the money, is there a way? Because older people are on set income.
I know. Well, that kind of goes back to, also, each plan is a little bit different and what their copays are. So kind of looking at that kind of stuff. And it really is, whoever works with, people you have to go over, each plan has what they call a summary of benefits. And you have to go through all of those different costs with them so they understand. Now, of course, they're not going to remember it because people only remember 10% of what you say. Right. But it's in a book there for them to refer back to, so yeah.
Okay. All right. Well, that is a lot. That's a lot. And it's a lot to still take in, to grasp, because we never know when we'll need it. Like with me, I had to go, I have a few back issues and I had to go see a doctor, and thank God most of all my stuff was covered. Yeah.
Yeah, and that is another good point that leads me down to another road, is that, people who are joining Medicare, they kind of make it, in a way, it sounds like B and D are, you can decide whether you want them or not, but I'm going to be honest with you, if you don't take it when you are first eligible, then you set yourself up for a lifelong late enrollment penalty. So do not recommend foregoing them because I don't need the Part D because I don't take any medication right now. One day you will need them, and then you'll want it, and now you're going to have a late enrollment. Now there are caveats and special circumstances, of course, and I'd be happy to answer any of those questions as well. But just in general, remember, if you are eligible and you don't have employer coverage from either you or your spouse, and there are, like I said, special exceptions, but it's best to get those, to take them. Take the B and the D when you can, because otherwise you can get late enrollment penalties. And now there's another cost tacked on. Right.
It's crazy, and that's the world we live in. I hate to say it, but Florida is the worst with it. Because I say that because there's so many, like you said, penalties and they don't readily tell you.
They don't tell you about it. I know, and that's the frustrating thing. That's why I think the Medicare 101, especially before you're getting ready to turn 65, is so important. Right. And those are the classes that I'm talking about trying to do. Right. Because people don't know, and if you get online and read it, because I have, it makes it sound like it's just a voluntary thing, like you can take it or not. Right. But when you get down into the nitty gritty of it, if you don't take it,
it's a conspiracy.
It's a conspiracy.
Gosh. And that's, I don't know. Okay, and I want to get kind of personal. Okay, so he said, does Medicare cover pre-existing things?
Yes, it does. Now here, okay, so there's a caveat to that. So it does cover pre-existing, especially when you're turning 65. You have some different coverage options that I spoke about earlier. You can, and it all depends on what your personal need is, but you have a choice of, you have the original Medicare A and B, but then you have the option of adding on a Medicare supplement, or sometimes they're called Medigap, or a Medicare Advantage. When you're turning 65, nobody looks at your health ever. And with Medicare Advantage, they don't ever look at your health. But say you opt not to get a Medicare supplement plan, and I'd be happy to educate a little more in depth some other time about that. But and you opt not to right when you're turning 65, but say now you're 67 and you're like, you look it up and you're like, wow, I wish I would have got that.
Right.
Well, now with those plans, because you're past that 65 initial period, they can look at your health. So if there was ever a time to get a Medicare supplement plan, if you can afford it, it's when you're turning 65 or when you're first getting your Part B coverage, because they don't look at your health. And unfortunately, we never know when a health crisis is going to happen.
That's true.
So you might be like, well, I'm really healthy right now. I never go to the doctor, this or that. Yeah, but 3 months down the road, you might have a crisis and now you've got yourself stuck. So
that's good. That's good. Did she answer your question pretty well, Cedric? My question was, even now, because I was going to talk about something else, but what you saying that, you know how you said if you're disabled, you got to wait 2 years before it actually kick in, right?
And it automatically will kick in after your 24th month.
So at that point, how do we ask for the B and D?
Okay, so you will automatically get the A and B if you have already, so you'll get your card. And then you have an enrollment period where you can get the D. And so you'll have an enrollment period. So you'll be notified of it. If you don't choose anything, then they will automatically just put you in a prescription plan.
Good. Okay, so they do. So that's the only time they will automatically.
They will.
Okay.
They will.
Okay.
Yeah.
And that's good to know, because when you said it, you automatically get it, and I'm like, okay, well, what about that?
Well, and it's also, so here's another thing. So there's so many different things to know. If you're drawing Social Security and you're getting ready to turn 65, then they will mail you your Medicare A and B card.
Okay.
But if you are not getting your Social Security and say you want to hold off until you're 67 or what have you, then you have to actually apply for it. And you can do that online, or you can go to your Social Security office or what have you. But that's one thing to know, is that if you're not getting your Social Security, then you have to, go forward to. But I'm going to tell you what, anyone who's getting ready to turn 65, they're going to be getting probably calls on the phone and things in the mail and this or that. So, I mean, just somebody's bound to tell you.
Gotcha.
And that's up to you with, whoever you want to do.
Okay, but who would wait till they're 67? There's people that actually do.
Well, I mean, there are some people, and it's probably those people that just weren't educated on it in the very beginning.
Gotcha. Okay, so we got to educate y'all.
That's right.
Okay, so he said he's 50, but the information is good to know. Yeah, it is. Hey, I'm 4 years behind you, sir. So I'm getting it too as you getting it, and I'm learning through what my mom going through, what I need to prepare for and get ready for. And it's hard because me and her don't stay in the same household, and so some of the things like we were discussing earlier, I forget. Right. And I need to be the one that remember, because they forget.
Right, exactly. And that's why and it just goes back to, that's why it's kind of good to have an outside person that is, educated on all of this stuff, to kind of help and guide you and remind you or even assist you with it. Yes. And you can't beat it if the services are free. Come to you free.
That's right. That's right.
So if someone's going to help you, why not let it be me?
And that's right. The other thing that I don't know if you paid attention to it, but the other thing that I wanted to know was, what is the statistics on people that actually know it and people that don't know it, and what is the statistics on if it's a race thing?
Well, that's a good question. I honestly don't follow that, and I will read statistics, but I do not ever remember that.
Okay, gotcha.
But
even in your experience, what is it, like 50-50?
let me think of back on it. It probably, you mean like people who, so just say of people that I have helped, of
and I
want to say honestly, it's probably more white people that I've helped, but
really?
But I think it's also because I haven't been able, because I'll help anybody,
right.
But I think it's probably because I haven't. Well, I'm new to the area, one.
Right.
And then also just being able to reach everybody and getting them to know that
right.
they look at me and maybe they're like, I really don't want to work with her, or I don't know who she is.
Right.
You know what I mean? So it's about getting to know that person too.
And I say that because as my race, with my race, it's hard for us to accept the fact that there's something wrong.
Right.
And there's a need.
Right.
And to reach out.
Right.
So
yeah,
that's why I say that, but that lets me know that because we're not reaching out,
right,
it's a possibility that we're missing out.
Well, that is true. Yeah, that's true. But like I said, I mean, you got to listen to that inner voice, and you don't want to just be, giving up your information to just anybody. So it's always got to be somebody that you trust. Okay.
Yeah, definitely. And like I said, I thank God for meeting Kelly through Mr. Victor.
I mean, and I thank God too. I'm so thankful to be here today.
Yes,
I really appreciate you having me on.
And Cedric, you said something. She said it earlier. You probably missed it. She said, "Is this going to be around in 15 years?" I guess that's when he turns 65. Which she said earlier, it changed yearly.
Well, the different plans and their benefits change every year. I firmly believe that it will be around in 15 years. I pray that it is, because if it is, in 15, then will it be there when I'm turning? Because I'm 44. So I mean, and this is something that we, like I said, the Part A, we paid for that. I mean, this is, so I don't see it going away. I hear, of course, everybody has what, everything's going to go away, this or that. I try not to pay attention to that because we're living in the here and now right now anyway.
Yes, we are.
And there's nothing I can do about that until it happens. But I believe that it will be here in 15 years. And so whenever you're ready for me, you just give me a call.
Yes. And the thing about it is, what Cedric said, in 15 years, we don't know, because like she said earlier, a lot of our Social Security is coming out of check. We've been paid out, so much. So in 15 years, you never know, the government might make everybody cash out, or
we just never know what's going to happen in this crazy world we live in.
Exactly. We just a go by the flow generation right now, and pray that all is well through it all,
and pray whatever happens, we're all going to be okay.
Yes. We just need to eat healthy, stay healthy, and as much as possible stay out of the hospital, stay out of harm's way.
Yeah. And sometimes, and I'm guilty of this too, swallow our ego and ask for help when we need it.
Exactly. And that's the biggest thing I could say is the biggest problem with our world today. Not asking when we know we need.
And I'm guilty of it.
Me too.
I'm working on it.
Because you gotta, like you said, it's people out here that abuse that. And I've had, in 3 years, I've had 2 or 3 people take stuff from me just because I'm being nice.
Right.
And I've learned, just to shut it down until I know for sure. Like, if I don't hear confirmation, it's over.
Yeah, I'm with you. I know I've had people ask me for money, and I'm like, wait a second, I'm working 2 jobs. You're not working any job. Like,
right.
What?
These people have asked me for stuff, and they got whole husbands. And I'm like, I'm single. Like, what are you talking about?
Right.
And I'm quick to say, if you need anything out, and I have it, you can have it. But
sure,
I have a problem with you having more help.
Right.
Than I do,
or we all have to help ourselves.
Exactly.
I fully believe in you. Gotta teach a man to fish.
What did you say in the office?
What did I say? Who knows?
Before we can help someone.
Oh, you got to take care of yourself before you can take care of other people.
Right.
Yeah.
Because it'll wear you down.
It will wear you down, and then you can't help anyone.
Yeah, and I've heard that so many times. Like, people have literally told me, Kim, take care of you first. Take care of you first.
Yeah.
And it's hard when you spend the lifetime taking care of others.
It is, and when you got a heart that wants to help people and you feel like you can help them, it's hard to say no sometimes.
Right.
And that's another thing. I'm always working on something.
Right.
I feel I'm working on a lot of things.
Yes.
But it's true. We need to. We do need to take care of ourselves, and sometimes you got to say no.
You have to say no. You have to say, I'm learning how to say no. I'm learning how to focus more on what I have going on, because I'm behind behind the ball on stuff. And so I'll be 50 in 4 years, and I'm glad that God kept me here this far, because it's things that I know should have took me out, like for real. Health, physically, mentally, emotionally, even financially. Yeah. Should have took me out. And that's
there's a reason that you're here still, you know?
Amen.
Right.
Yes. But anyway, like I mentioned earlier today, because we're winding down the show, like I mentioned earlier today, I'm not going to be doing Facebook Live as often as I was every show. I'm not going to do it. It's by the leading and when I'm available to do it. But I will still be on the app. I'll still be doing on a personal note. Yeah, I know it's not interactive no more, but it's things that we're trying to do, and places we're trying to go as a station. And with that, we have to embrace the change. Everything is migrating anyway, and Facebook doing too much, to be honest. Every time we play music, they want to shut us down. Instagram getting like that too. So we say, what's the point besides the live? But even if people are coming, like 5 people are live, yes, there are 5 people that I'm helping, but there's a slew of people that come back and say, I couldn't hear it. I can't hear it. It's because of Facebook. It's not my fault. Yeah, that's censorship. And the biggest thing for me is I'll say this. I had someone come up to me yesterday. I was at an event. Someone came up to me and they said, I love what you're doing. You're really helping, and continue to do the work. And I am continuing to do the work. I just think that it's time to go outside of the 4 walls. Yeah. Into the 4 corners.
Well, that's a great thing about the world we live in now, and all the different ways that you can touch people, is that you don't have to do it that way. Like you said, you can record, and you still have your content out there and all that. So.
Exactly. And so those are the things that we're doing. And we are definitely trying to, go a different route. Excuse me, somebody... It's good old people don't miss a beat. But for the most part, still join me Mondays at 11 a.m. Central Standard Time with On a Personal Note, as well as Wednesday at 9 with On a Personal Note. I have moved my times for those that don't know, because Gerald keeps saying that I keep moving my times. Only moved it once. So 9 o'clock, because that's where we actually meet with Mr. Victor. Yeah. And we all get together and we
network and talk and
collab and make things happen, and it's happening.
It is.
And so we have to be ready to adjust and adapt. That's what I talked about before, adjusting and adapting to the times that we're living in, not to the place where you give yourself completely, you lose yourself, but to the place where you're going out and you're making a bigger difference than behind here. Yeah. So this is Kelly Kniss.
Yes, Kelly Kniss. And I'm with Complete Care Insurance Services. Like I said, it's just me though, Kelly Kniss. And my phone number is 850-400-3012. If you want to give me a call, or you can always email me, Kelly Kniss, KELLYKNISS1 @gmail.com. I'm working on trying to get more tech savvy with my Facebook and all of that stuff, my website, but I'm not quite there yet.
She did a whole...
I'm working on
it. But she is definitely getting herself out there. Y'all be ready. Really, Cedric? He talking about you getting too big too. Listen, I'm telling you, I'm seeing God move. And when God moves, you got to move with him. You can't just stay there. You're gonna miss out. And I've missed out too much. And it goes back to just being ready, being apt to teach and ready to go. Yeah. So you're gonna have to contact me another way, Cedric. Yep. But go download the app. We tell y'all Google Play. I'll be there. You won't be able to interact, but you can inbox me and tell me, hey, I watched your show today and I got this, that, and the third, and I'm cool with that. But this your girl, Kimberly Therese. We're On a Personal Note. We out of here.
Thank you so much for having me.
Yes, thank you for coming. I appreciate it. Yes. You accepted the call. Yes, in Jesus' name. So y'all have a good one. See y'all next time.